PRRT or radiopeptide therapy for neuroendocrine tumors has become the standard of care for the treatment of low to intermediate grade neuroendocrine tumors. PRRT is actually administering a radioisotope which targets the somatostatin receptors which are expressed on these patients of well differentiated neuroendocrine tumors. And by actually targeting these somatostatin receptors, we are able to deliver a very high dose of radioisotopes which goes and attaches to the tumor cells without damaging the surrounding cells. Now, this becomes very important because many patients with neuroendocrine tumors have got large volume metastatic disease in the liver. We need isotopes which will go and target the tumor without damaging the normal liver, or in patients who have got skeletal metastasis, we need isotopes which will go and target the tumor without damaging the surrounding bone marrow. And by using PRRT, we are able to do exactly this, and that is the reason why PRRT is often called the magic bullet therapy, because it goes and attaches these radiopeptides, they go and attach directly to the tumor cells without actually causing any kind of harm to the surrounding structures. PRRT can be done with various radioisotopes. The beta emitting lutetium is the most common radioisotope. Yttrium-90, another beta emitting radioisotope which has got a higher energy than lutetium and can be used to target bigger tumors or patients who have got larger metastatic disease. And now there is a growing body of evidence which says that PRRT can also be done with the novel alpha emitting radioisotopes like bismuth-213 or actinium-211. The alpha emitting radioisotopes have got a energy which is almost 5 times that of the beta emitting radioisotopes, and thus their cell kill is far more than the beta emitting radioisotopes. PRRT is given in fractions. Typically, every patient receives about 4 to 6 fractions of PRRT. Each fraction entails an injection of the radiopeptide which may be given intravenously or intraarterially. There is a gap of about 3 months between each fraction, and the number of fractions depends on the volume of disease and the response which a patient has to the various tumors. Administering radioisotopes intraarterially allows us to actually deliver the radiopeptides directly at the site of the tumor, most commonly into the liver, sometimes even in certain other sites which have got a feeding artery, we can administer the radioisotope directly into the tumor, thereby improving its efficacy. At our center, we treat about 250 to 300 new patients of neuroendocrine tumor every year. Being a tertiary care cancer center, each patient is discussed in a multidisciplinary tumor board. The protocols may be tailored to help improve the efficacy of PRRT in any individual patient, and we actually practice personalized medicine. We may actually combine PRRT with some targeted chemotherapy to improve the efficacy. We may administer some isotopes intraarterially. We may use tandem therapy, whereby 2 different radioisotopes may be used to give the maximum benefit of PRRT to patients in a particular given setting. all this is possible because we work with a team of researchers who not just practice the clinical part of PRRT, but are also actively involved in very sophisticated algorithms of dosimetry, of tumor biology, of looking at various cytogenetic and molecular mechanisms which govern the efficacy of PRRT on these patients of neuroendocrine tumors. Our team includes people from medical oncology field, from pathology, from cytogenetics, from surgical oncology. So many times patients may benefit from a combination of therapy, and that is the benefit which we give to every patient. PRRT does not just improve the survival of patients, it improves the quality of their lives. Many patients of neuroendocrine tumor are miserable because they have intractable diarrhea, they have flushing, palpitation, hypoglycemia, and PRRT not just extends the survival of these patients, but also improves the quality of their life. We cater to patients not just from India, but also from the surrounding countries, as well as from faraway countries like the United States, Canada, New Zealand, Australia, and many of the Southeast Asian countries. Patients come to us not just because of our expertise in treating patients with PRRT, but also because they become our friends for life. Neuroendocrine tumors are tumors which are relatively indolent, and patients survive for many years with PRRT. And as they get on with their lives, they remain in touch with us and often become our friends for life. So, if you need any information about PRRT, please get in touch with our team, and we would be happy to share the details of the work that we do and to see whether we can help you with any form of PRRT.